Hi, my name's Whitney. I'm a family nurse practitioner student.
Hi, nice to meet you.
Nice to meet you.
My
What's your
name's
name?
Andrea.
Okay, Andrea. I'm just washing my hands here. Andrea, what brings you in today?
I've had some back pain.
Okay, some lower back
pain, like down in here.
Okay, we'll get to that in a moment. Can you tell me your birth date, Andrea?
October 29th, 1957. I'm an old lady now.
Okay, so you're a 60-year-old Caucasian female.
Mm-hmm.
And can you tell me where you are today?
And I'm at Research Medical Center.
Okay, so she's alert and oriented ×3. She's dressed appropriately for the weather, pleasant affect. And so now tell me more about that back pain.
So it's sort of just happened gradually over the last few weeks. It's been getting worse over the past few days, though.
Mm-hmm. Okay, so the onset has been gradual but worsening over the last few days. The location is your lower back. How about the duration? You said for a while
several
now?
weeks, yeah.
Okay. Is it kind of constant?
Yeah, it's like a constant achy, crampy feeling. Sometimes it even gets a little like tingly or numb.
Okay, so that's the character that you describe. And aggravating, is it worse when you sit or stand?
Definitely when I stand, walk around. I feel like it gets a little better when I like rest, like sit in a chair.
Resting makes it better.
Mm-hmm.
How about any NSAIDs? Have you tried any Tylenol? Or
I think
ibuprofen?
I took some ibuprofen the other day that seemed to help. Yeah.
Okay. So aggravating and alleviating factors. How about radiation? Does it radiate to?
It sort of goes down to my butt.
Into your butt.
How
about into your legs?
Sometimes more like my right leg. I don't know why. I feel like when I stand, I sort of have my weight on my legs.
So it radiates to your buttocks and right leg sometimes. We already touched on the timing, like when you're working and standing. And the severity, like on a scale 0 to 10, what is it at rest and what is it while standing?
I'd say while standing or walking, it's like a 6 out of 10. But then when I'm resting or laying down and taking my ibuprofen, it's like a 2 out of 10.
Okay. Well, I'm going to ask a bunch of questions, kind of hone in on what might be going on here. So, have you had any recent injury, trauma?
No.
Recent motor vehicle accident in the past days or weeks? Okay. How about any weakness in that back or legs?
Not really weakness, but sometimes after standing for long periods of time, I feel like my back's just gonna like give out on me.
Okay. So not weak per se, but something going on there. How about numbness and tingling?
Yes to both. Sometimes just in my right leg.
Okay. Any trouble with your bowel or bladder dysfunction?
Oh no, that's working fine.
Okay, well that's a good sign. Sometimes that lower back pain can impair that. How about headaches recently?
Not at all.
Muscle twitching or spasms you've noticed in that area or the legs?
No.
Okay, and any joint stiffness?
No.
Anywhere, especially the legs or knees or anything, hips?
No.
Okay, so past surgeries, I have here 2 C-sections, one in 1984, one in 1986, so 2 children, I'm assuming, and your gallbladder out in 2000, is that everything?
Yep,
okay.
2 kids.
All right, I have here your mother is 87, she has hypothyroid and a bit of dementia going on, recently diagnosed with that dementia, and your father is 88, he has high blood pressure, high cholesterol, and a triple bypass surgery a few years ago. Okay. And your sister, she's how old?
She's 62.
Okay.
And she's just really anxious and she's big.
A little overweight, obesity perhaps. Okay. And how about your brother?
He's 64 and he just has high blood pressure, I think.
Okay. All right. So you watch that blood pressure, and with that family history of triple bypass, although he was older when that happened, just always be conscious of any testing, okay?
Okay.
Your last pap smear and well woman exam, when was that?
Both of those were summer 2017, and they were good.
Normal.
So.
This summer. And mammogram around that same time, perhaps?
Yep.
Okay, was that normal?
Yep.
Okay. And your colonoscopy, I see, was in 2015.
Oh,
Any
yeah, I remember that.
there?
Nope.
Okay, good. So you can repeat that in 2025, probably 10 years if you got a good report. Medications, you mentioned the ibuprofen. Do you know how much you take and how often?
Yeah, I actually wrote that down. I take 400 milligrams every 4 to 6 hours, and I take that pretty regularly, especially when I'm working. I'm standing all day at work.
You said that seems to help you. So as long as you're not taking too much and too often, always take just as prescribed. How about Tylenol? Have you tried that?
Yeah, I tried 325 milligrams every 6 hours for my pain, but I don't really take that as much as
the NSAID works better. Okay. And a multivitamin or any herbs supplements over the counters?
Just a multivitamin with iron because I don't like a lot of red meat. So.
Okay. And how about allergies to food, drugs,
Not
or environmental?
No.
Okay. Tobacco use?
I smoked socially, like just when I drank in the 80s and 90s, and I quit in the mid-90s. So
okay, good.
It's been a while.
Alcohol use?
I'd say socially again, just 1 to 2 glasses of wine on the weekend.
Okay.
Nothing major.
How about drug use?
Oh, never.
Never. Okay, great.
I stay away from that stuff.
Okay, and you mentioned for work you're on your feet all day. What do you do for work, Andrea?
I'm a pharmacy tech, so I do quite a bit of walking.
You're always standing, working on that high countertop. And are you married?
Yep, been married for 35 years with 2 kids.
Okay, and how about your diet and exercise?
My diet's very healthy, I would say, and I exercise like 5 times a week, maybe an hour a time, so I think I do pretty well with that.
Okay, good. Not too much caffeine and plenty of water, correct?
Oh yeah, lots of water.
Okay, great. Do you have any pets?
Just one golden doodle named Tuggles.
Okay.
And no one else.
Okay, great. How about recent travels out of the country or anyone you know?
No.
Okay. Okay, so my tech took Andrea's vitals. Her temperature was 37 degrees. Blood pressure 118/60. Heart rate 68. Respiratory rate 14. We're running out of battery here, so we might pick things up. Oxygen saturation was 100% on room air. Her height was 5'4", weight 125, giving us a BMI of 21.5. She mentioned her pain was a 2 at rest, 6 while standing and working. Last menstrual period not applicable because she went through menopause in 2014. As I mentioned, general exam, she's appropriately dressed for the weather, alert and oriented ×3, and cooperative for the exam with a pleasant affect. I'm going to go ahead and take a listen to your heart and lungs, and then we'll move on to examine that lower back. Aortic? No, aortic. Pulmonic. Erb's point. Tricuspid. Mitral. And apical pulse for 60 seconds. Okay. Her pulse again was normal at 68. No murmurs, gallops, or rubs were noted, and a normal S1 and S2 was heard. So now I will take a listen to those lungs, and as always with the heart and lungs while listening, we'd go under the clothes, but she's wearing clothes for privacy on this video. So the lungs. Okay. deep breath for me. Okay, so I did listen under that bra strap, which is often forgotten. Just inspecting her skin. It's warm, kind of dry, which that time of year. No variations, lesions, or any suspicious for infection or anything going on. Her skin is normal. Upon examination and palpation, and now we're moving on. So Andrea, if I could have you stand up, and I'm going to have you come over here perhaps, and we're going to have you flex your back. I know some of this may cause you pain, so don't go too far if it does cause you pain. So flexion is going to be leaning forward. Does that cause you a little lower back pain, I bet? Yes.
Yes.
Okay, so don't go too far if that causes you pain.
Okay.
And lean backwards. That probably causes you some pain as well.
Yeah.
Okay. Not lower back. Okay. And how about rotation? If you could go side to side for me. Okay. No limited range of motion there, but it does again cause you some pain.
Painful.
Okay. And how about laterally? If I could have you bend to the right and bend to the left. So you still got that range of motion, but causes you lower back pain.
Mm-hmm.
Okay. Well, don't do too much if it's causing you pain. So that was the range of motion in all directions. It does cause her some pain. Now we're going to go ahead with this scour test to rule out anything that may be coming from the hip. Okay, so if you could go ahead and lay on your back, Andrea, on your back.
Oh.
Okay, so this is the scour test. Just going to bend your knee for me. And pushing down on that femoral head. And moving. Any hip pain with that? Okay, now I'll do the other leg. Any hip pain with that motion? Okay, now if I could have you, so a negative scour test. Now I'll do the Faber. Actually, you can stay in that position for the Faber. Make a figure 4 on your knee. And I'm just going to, push your, like this. And I'm just going to apply slight pressure. Does that hurt your hip at all?
No.
Okay, so it doesn't seem to be coming from your hip. Anything there?
No.
Okay, doesn't seem to be coming from your hip. Now if you could roll over, sorry for all that awkwardness.
Oh, that's okay.
With those legs slightly hanging off without bending your knee, and lay your chest down. If you could lift the legs.
Both.
Well, at the same time. There you go. And hold it for 10 seconds. It is probably causing you some pain, but you're not having any weakness, which is what I'm checking for. So she was able to hold that for 10 seconds without any weakness. Now you can roll over and I'll help you sit up.
Oh, thank you.
All right. So some of those range of motion did cause you some lower back pain, but I didn't notice any weakness in your back, which is a good sign.
Good. Awesome.
So that last test was called the Krauss-Weber test, testing the strength of your back. So overall, I would suspect that Andrea may have some spinal stenosis going on because she is over the age of 50. It is gradual in onset, and the pain is worse during the day, aggravated by standing and relieved by rest and ibuprofen, which is an NSAID. Also likely stenosis because she reports occasional numbness, pain, tingling, and cramping in the leg. Luckily, it's not a severe case of spinal stenosis at this point. We've seemed to caught it early because there's no bowel or bladder affected. I doubt that it's osteoarthritis because there's no decreased spinal mobility, which is often seen with OA, and the scour test was negative. Also, no hip origin. We ruled out a lot of hip stuff, but also probably ruled out herniated intervertebral disc. It's not likely a herniated disc because there was no flexion or trauma injury preceding the pain and no tenderness or spasm reported. She didn't have any diminished strength while we were testing, and there was no pain or numbness during, I missed one, during the straight leg test. If you could go ahead and lay on your back for me. lay on your back and then hold it straight. And I'm just gonna lift. Does that cause you any pain?
No.
Okay. Lift. So that would cause pain if it was a herniated disc. So straight leg, lift. Now I'll go ahead and bend, lift, bend, lift. Okay, sorry about that.
That's
I'll help
okay.
you up. Usually that would be
Thank
all
you.
in one fell swoop, but my battery running low is making me nervous and forgot about that one. So the straight leg test was normal, which doesn't make me think it was a herniated disc. So thanks, Andrea.
Awesome. Thank you so
Have a
much.
good day.